Hello, my name is Dr. Alexander Kudakov, and I'm a urological oncologist. I work at a busy tertiary referral center and see many patients who present with complex surgical issues. I find DrawMD extremely useful in my clinical practice, especially when counseling patients regarding a robotic prostatectomy. Let me show you how I do it. I pull up a prostatectomy background either on my iPhone or my iPad and orient the patient. I show them that their feet point to the left on the image while their head points to the right. I highlight the position of the neurovascular bundle in relationship to the prostate. I then show where the urethral sphincter is. I orient the patient by showing the rectal stamp, and then I highlight the fact that the prostate and the seminal vesicles are removed and that ejaculations after the surgery are dry. I then utilize the prostatectomy stamp and demonstrate what happens as a result of the operation. The anastomosis stamp is then used to show that the bladder and the urethra are sewn together during the surgery. Then I place a lymph node stamp to demonstrate that a lymph node dissection is done when appropriate. I then highlight to the patient that a catheter is placed at the end of the procedure. When the catheter is removed, which I remove by pushing the undo button, I highlight the fact that the urinary sphincter needs to return to its baseline function before continence is regained. I then highlight that the challenges with the neurovascular bundle returning to its original function. I then answer any of the questions that patients may have regarding the pertinent anatomy, and then I go to an abdominal cavity or superficial anatomy background and demonstrate where the port sites and drains would go during a robotic prostatectomy. In this way, a consultation that can often be extremely confusing for the patient is extremely efficient and clear. Try DrawMD in your practice. I think you will be amazed how receptive the patients are to this approach.